Dr. Raj Kalsi is a board-certified emergency physician. He joins me this hour from Naperville, Illinois, and thanks for joining us. Look, we have another day, another record. The numbers are staggering, and they're also incredibly scary. I mean, what do you fear most when you see 2 days in a row of cases above the 50,000 people being infected?
Paula, it's a great question. What I fear most is that the fatality rate will follow like it did in the beginning of this COVID viral campaign. So early on, COVID was effectively very deadly compared to things like influenza, which we see every year. It was a novel virus. It was a new virus. We've never seen this before. And I worry that these surges and spikes, if it is as deadly as it was early on, then we're in for a significant problem in the next 2 to 4 weeks as we start filling up ICUs and seeing people die from this.
It's interesting, the new shorthand around the country, especially by some of the governors, is that, look, the people who are getting it now, the average age is much lower. And they're saying, everyone calm down. That means we'll have fewer hospitalizations and fewer deaths. And while we all hope that's correct, it seems like you're saying that, look, at this point, with the numbers so high, that it still poses a significant threat to everyone.
It absolutely does. One of the things that you guys in the media are doing a great job is you're calling attention to this significant public health problem, the pandemic. And because of that, everyone is incredibly aware when they've never ever been aware of a viral illness or cared about a cold. They're coming to ERs, their primary doctors, to get a COVID test. And then they're given the information that perhaps they have this virus, and then they're hopefully quarantining. So this is incredibly important to know whether or not you have it. Even if it's young people having this illness, they are still, if they have the virus, going to spread it much more aggressively than, say, a nursing home patient who's bedbound or wheelchair bound.
Yeah, and that's such a good point. We forget that they're out and about, and until they know that they have the virus, they potentially could infect so many more people. Now, there's a new study that says the way the virus has mutated, it's actually much more infectious. I think some of us have already seen the anecdotal evidence of that. Thankfully, it's not making people any sicker, but still, that information that the virus is now much more infectious, how significant is that?
Absolutely. This will be earth-shattering news if it's truly holding up to virology, which is that when we compare viruses like MERS and SARS-1, those incredibly deadly diseases, they killed the host, the human, so quickly that that human couldn't even leave their home to go infect somebody else. But now, in terms of virology, as a virus sort of propagates and as more and more people get it, and the people who died from it are not around, sadly, on the planet to infect other people with the deadly strain, perhaps the less fatal virus is promoted and is the one that propagates.
Yeah, and I guess the moral of this story is we still learn so much about this virus every day and every week. Still so much we don't know, though. Doctor, if you could take us kind of inside your world of the medical profession and the medical professionals this has been a long haul for them. You're working on 4 months. Do you worry about fatigue at this point among all of them?
Absolutely. We are so tired. We are broken. But Paula, we've been doing this for as long as we've been in this career, emergency medicine, the front lines. Nobody, effectively took any focus on emergency medicine until you all gave us the appropriate and wonderful credit that we were on the front lines, putting our lives on the line, which we have done anyway. And we knew that if anything crazy like Ebola or this new pandemic or something even more catastrophic happened, we were going to be the first ones to be exposed and putting our lives on the line. We're tired. Also, on top of the coronavirus patients that are coming in, we're seeing droves of our typical other patients coming in, heart attacks, trauma, people with abdominal issues, people with cancer issues, pediatric emergencies. And this is all very overwhelming at times because we have to do so many things to precaution ourselves and protect our patients from the waiting room all the way to their disposition, either admitting to the hospital, the ICU, or being discharged home. We have to protect them from COVID, and it's taking a huge toll on us emotionally, mentally, and physically.
Yeah, and as you said, it's been 4 months, right? It's not like people have been waiting at home for medical care, and then they are now coming into the hospitals because they can wait no longer. Dr. Raj Kalsi, thanks so much for joining us. Be well.
Thanks, Paula. You as well.